Well, good afternoon, everybody, and welcome to this session where we're going to be talking about allied health, digital growth, and sustainability. My name is Sandy Vincent, and I'm with the education team here at the PHN. I'm very glad to have you here with us today. I'd like to start by acknowledging the traditional custodians of the lands that we all live and work on, and pay my respects to adults past, present, and emerging. Just a couple of housekeeping things before I hand over to my colleagues. I would like to just confirm with you that this meeting is being recorded today. If you have any questions during the course of the session, please feel free to add those into the chat, but there will be times we will pause. We will have an opportunity to actually ask your questions, and at the end of the session, there will be an evaluation that will pop into the chat. So please feel free to complete that for us. And with that, I would like to hand over to Jo, who's going to start the session for us. Thank you, Jo.
Thank you, Sandy. Welcome, everybody. I'm Jo Coots. I'm the Integration and Partnership Manager at the PHN. You'll also see on screen we've got Ibby, who's from the Digital Health team. Jo Dean, she works in the Integrated Allied Health team. And Peter DeMarchi, who has been leading the Savvy or the Sustainability and Viability Initiative for Allied Health. So welcome. I would like to acknowledge that we're all meeting on First Nations lands. I'm on the Kamilaroi lands up in Tamworth and would like to extend my respect to the elders past, present and the future leaders of tomorrow. I think we've covered off on the introduction and housekeeping, but just to let you know, this is really intended to be an opportunity to ask some questions ahead of you completing the 2 surveys or assessments that are currently open. I will just do a little introduction and then pass over to Ibby and then Peter to talk to the 2 assessments in more detail. So what are they is probably a key question. So the first one, the Sustainability and Viability Initiative for Allied Health. This is the first time that we've run this survey, but it's based off the success for the general practices Sustainability and Viability Initiative. And it's intended to be a long-term initiative designed to strengthen and stabilise the allied health sector across the region. So essentially, you answer a few questions and then you get an overall score and then a score in the workforce, finance and operations area. And from that, we then look at collectively, but also in a tier. So you'll be, as a practice, be allocated into 3 levels of tiers and provided and offered tailored support accordingly. That's a Sustainability and Viability Initiative as a bit of an overview. In terms of the digital care assessment for allied health, this will be the second time that we conduct this survey. It was first done in 2023 for allied health. And from that, it brings out a few different areas and will assess you at the practice level around your digital infrastructure, your practice readiness, digital literacy, your technology use and your clinical leadership. And then again, you get tailored action plans and support following that, which Ibby will speak more to. So it is intended, so the who is around who's intended to complete the surveys. In both instances, it's really somebody that has a strong understanding of your practice and your operations. So someone such as a practice owner or a practice manager or a senior admin staff member. So essentially a question is, why should we do this as well? Really, the Savvy opportunities will only be open to those practices that complete the survey. And for example, we have done leadership courses and a range of other initiatives around business support, which will only be open to practices that then complete the Savvy assessment. For the digital care assessment, you will get an individual action plan, but an example of what the PHN has offered to practices is an online learning management system. So we created allied health resources, and then have that open for allied health practices that have completed that survey. Will give a greater insights about where to start and where they are on that journey ahead of going through that LMS. So these are some of the overarching benefits, is that really doing both surveys will give you overarching practice insights. You will then be able to develop a custom plan about where you are and what you can take forward based off your capabilities and opportunities within your practice. It will help to influence the PHN allied health initiatives, but also sector-wide advocacy across the allied health space. It should provide some digital enablement and viability for practices across the region so that you can continue to care for patients, which is really the intended outcome, is that we have a strong primary health care sector that supports the residents of the Hunter, New England and Central Coast regions. And as mentioned, you will then gain access into relevant programs, pilots and innovation programs. So I might just pause there. If there's any questions now, there is also the chat function that we could then also answer questions at the end. But otherwise, I will pass to Ibby.
Perfect. Thanks, Jo. All right, so the digital care assessment for allied health. As Jo mentioned, this is the second time we are running this, the first time having been back in 2023. A few of you, I think I've seen some familiar names and so may have been involved in that one. And I think there's a couple of you who I may have already reached out to directly just to say, hey, this is happening again, and we'd love to see you back. If this is your first time, we'll talk a little bit about what the assessment is. So it's an online assessment developed by our partners at Semantic Consulting. It's designed to help healthcare services understand their digital capabilities and their digital maturity by reviewing key areas like digital infrastructure, technology use, digital literacy, clinical leadership when it comes to innovating and bringing in new technologies, and then also just the staff and patient readiness at a practice level. For those of you who were here the first time we ran this assessment, it has been expanded a little bit, particularly in the action plans. And there's some more, I guess there's been some more targeting to particular types of allied health and, things that aren't relevant to one. We're not going to focus on, you were going to try and make sure we filter some of that information out. But we're also, it's also come from a lot of feedback from other regions that are doing the allied health assessment as well. So why it matters to us. So digital health is becoming a more prominent feature of healthcare, as we have all probably seen. There's increased risks around cybersecurity. There's greater expectations from patients in terms of how they can access services. And there's just big leaps in the availability of digital tools. Things like AI that weren't really a thing 5 years ago are now suddenly being used all over the place. At the PHN, we're really hoping to use these results to directly inform our digital health strategy by knowing what's going on in practices, what's working well for them, what they're struggling with. That can better help us plan and guide the support that we offer. We ultimately have a goal of trying to ensure that we help practices at their stage of readiness. So we kind of split digital maturity into 3 levels. So there's foundational, intermediate, and advanced. For foundational practices, we really want to make sure they're hitting any standards that there are. So making sure they're meeting all privacy legislation, making sure that their technology is capable of, managing through a disaster, that they've got security in place to avoid, ransomware and cyberware attacks. For those who are intermediate, we really want to focus on efficiency and building optimization of the current systems that you use, figuring out how can you offer care in a more efficient, more streamlined way when it comes to digital tools. And then for advanced practices, we really want to make sure that we're giving space for them to showcase what they're doing and how they're using new models of care to meet some of the needs that we have in terms of workforce and just trying to meet the demand that's out there. We don't want this to just be, information coming to us and then nothing else happening. So in terms of how it helps practices, by completing the assessment, there's a real valuable chance, an opportunity to just become aware of some of the tools that are in place at the moment and available to practices, to reflect on the current state of your practice and just consider tools that you might not have been aware of. When you receive your results, you'll actually be receiving a score in each of those areas I mentioned before, the digital literacy, clinical leadership, which will give you a bit of a sense of what are the areas you're strong in, especially when compared to sort of our region as a whole, and what are the areas that maybe you've fallen a little behind in or just haven't been able to focus on. And from there, we will then provide a digital care action plan, which will give some sort of insights and resources as to how you can start to begin working on those areas. I'll go through that a little bit more in the next slide. Lastly, we are also, to support those action plans, we are going to be awarding 5 participating practices who complete the assessment with a $2,000 digital care grant, which will help to sort of fund and go towards making some of those digital improvements. Now, the action plans themselves. So the action plans look a little bit like this, though those resources are not specific to allied health, and the ones we send will be. You'll note the plan there's an action, there's a link to the resources, and then we also put in a reason for the recommendation, which is really great if you do a few items and then come back a month and a half later and go, why was that on the list? You'll be able to, it'll sort of explain like, oh, you said in the assessment maybe that you weren't doing video telehealth, you were only offering phone calls, and that's why it's been recommended that you look into, this funded video option. The actions are written to be as practical as possible. Before I was with the PHN, I was a practice manager, so I understand the need for just real clear, concise, this is the information, this is how you implement it. And it's very easy for things to get blown out. So we really tried to keep it as simple and as practical as possible for you. There will be 3 priority recommendations in green at the top of the action plan. And we've done that as sort of a way of like, if you only do 3 items, these are the key ones. And so we've got a bit of a priority list for each of the actions. And so you'll see what is sort of the top recommendation. They are designed to be practice-led. So we're not chasing you up about this after the assessment. This is for you. You can do as much or as little of this as you want, but we love to hear when practices are using it. And obviously, we also are happy to support practices in engaging with those recommendations and sort of starting to action them and put them into place. In terms of a timeline, once the assessment period has closed, we will send these action plans within 2 weeks is the current plan. We just finished up GP and I think we got them out within a week for that. So I'm hoping to keep to that, but we'll say 2 weeks to give ourselves a little bit of leeway. And when they go out, we will also send the link to the expression of interest for the digital care grants. So we are only able to offer 5 of them at the moment, but essentially we will be looking for practices to sort of say what they're planning to do in terms of their action plan and what recommendations they're going to implement and how they want to do that. And then we will assess based on the responses we get. So how do you participate? It is run through a platform called Kaleidoscope. The link will be sent out to you a bit later. I think there's actually already a link to our landing page on the website in the chat. So you can go there, you can access the digital care assessment link. You'll pop in the details of your practice. It takes about 20 minutes to complete, but we're starting to see that a lot of practices are getting it done in 10 to 15. So it is pretty quick. The assessment opened 2 weeks ago now and will be open until the 23rd of October. So we've got 1 month to do it, but I would suggest that you get in quicker than that to make sure that you've got it done. And as Joe mentioned before, we're really looking for business owners, practice managers, or senior admin staff, people who really know about the infrastructure in place and the operations that take place at the practice level. So with that, I will hand over to Pete, but I might quickly give a chance. Is there any questions at the moment? Feel free to chuck them in the chat. Otherwise, we will have some time at the end and we can come back to it. All right, Pete, I'll leave it to you. Any questions, just chuck them in the chat.
Right on. Thank you, Ibby. My name is Peter. I'm a practice support viability officer with the PHN. I have a background in exercise physiology, and I previously managed an allied health practice. And I'm a huge advocate of allied health's role in primary care. I think there's such an important sector in providing those services to our communities. So I'm happy to introduce to you the Sustainability and Viability Initiative for Allied Health. So Savia was, as Joe mentioned, it was developed following the success of Savvy for general practices. And sort of how it works is it encompasses an assessment. So that's where you fill out an online assessment. It'll give you a score based on workforce, finance, and operations, as well as an overall score. So what that does is it gives you an objective measure to compare year on year when we eventually run the assessment again. And it also gives you a chance to really review those key areas of your practice. So we're talking about workforce sustainability. So being able to recruit and retain clinicians to serve the needs of your community. Financial viability. So, generating enough revenue to cover costs and other financial obligations, but also providing accessible services for your community. And in terms of operational capacity, it's really about having the right skills and resources on hand to provide high quality services to your community. So after the assessment is complete, here at the PHN, we'll run an evaluation. We'll monitor the results and kind of look for those key themes that are going to inform the outputs, which are the support initiatives. Those support initiatives might include things like business coaching, grants, education opportunities, things like that. So why are we doing this? So our vision at the PHN is to support a sustainable and thriving primary healthcare sector in the region. And to do that, we not only need to understand what those issues are that allied health practices are facing, but also actively address them. So ensuring that you're equipped to thrive and meet the needs of your community. And without a doubt, allied health is a vital pillar of the primary healthcare sector, and they play a critical role in delivering comprehensive, person-centered care across our health system. An allied health sector can also alleviate pressure on the wider health system. So, for example, GP practices, hospitals, aged care facilities, and can really enhance outcomes in sectors outside of health even, such as education, and I'm sure you all know that. The benefits for your practice, through the assessment and the results, you can have a greater awareness of those areas of strength and some additional areas of growth. And by participating in the assessment, as Joe mentioned, you'll have access to PHN-sponsored resources and initiatives that are targeted and informed by those assessment results. So your voice really matters in that. In terms of the outcomes, the short-term outcomes we're looking at immediately, that's participating in the assessment. So having that improved awareness of your strength and growth opportunities, and that will then inform some of those medium-term outcomes, which will be the initiatives to improve sustainability and viability. And for your practice, as I mentioned, that could be business development, education, training sessions, viability grants, things like that. Long term, what we hope to have is an enhanced capacity to continue delivering high quality and community-centered care in our region. and that includes a thriving and integrated network of allied health providers. So how can you participate? So you can fill out the Savvy assessment using the link, which is found on our Allied Health landing page. The results will be confidential, and any data used in the Insights report will be de-identified. The Savvy assessment is being delivered by the REDCap platform, which is in collaboration with the Hunter Medical Research Institute. Who should fill out the survey? It should be respondents who have an adequate knowledge on the practice's workforce, finances, and operations. So it could be business owners, practice managers, business managers, or similar roles for the most accurate results. Time to complete, like Ivy said, around 20 minutes or so. It depends on how much knowledge you have on hand, and if you feel like you need to look a little bit more in depth at your information to get the best results, and also how much you write in the open answered questions, which provide a lot of context for us. The initial results will be released at the beginning of October, probably after the long weekend. October 7th is what we're looking at this point. And for us, the assessment link will remain open for new practices to join Savia throughout the year. So as I mentioned, your voice matters. We really want to hear about your strengths, challenges, and opportunities to drive that meaningful care and to shape how we can support allied health businesses in the region. And we look forward to sharing those insights with you and implementing some valuable initiatives for the community. And I want to thank you for building a stronger, more sustainable future for allied health practices in the region. And with that, we will move on to any questions. Thank you.
There's a question in the chat from Jasmine. After completion of the severe assessment, will everyone be able to access coaching grants and education? If not, how is it decided who will be able to access these supports?
That's a good question. How it works in the general practice is that for allied health, we will sort of try and deliver these initiatives on scale to include the most practices that we can. Ideally, we'll try to include as many as we can. In some cases, if numbers need to be limited, it may be like an application process. Things like grants usually go through like an application process where you have to justify your needs and things like that. So it'll vary depending on the initiative, but the hope is that we can kind of have touch points on as many practices and participants as we can. Good question. Thank you.
Dave has, sorry. Oh. Yes, come off mute, please, Dave, and ask your question.
Is my video there? I feel like I just disappeared when I came off mute. That was weird. Anyway, I'll ask my question. The cybersecurity grant that came through, we sort of got a notice and then nothing, and it's been quite a few weeks. Is that tied into the digital? Have I missed something? I'm just trying to see how they go together and how quickly do these things unfold? Like, yeah, I don't know. We were just sort of excited to get moving, but it seemed like not much happened with that one. Just wondering if they're tied together and some context to where that's. I know that's not what this is about, but wondering about that one too.
That's a fair enough question. There's a couple of. Joe, do you have?
Just speaking to the lead of that this morning, so I've probably got some information hot off the press that some comms are coming out this week, just about some one-on-one kickoffs for the cybersecurity grants. So for those who don't know, we did have some cybersecurity
grants open, so people that have been accepted for that grant, which was everyone who applied. It's just really about to kick off, so those comms should be expected this week, Dave.
And sorry, the cybersecurity grants is probably an example of a foundational piece for practices as well, because it's essential for really all operations across a practice. Ibby, I don't know if there's anything that you'd like to add to that.
No, cyber is one of our top priority items when you get your action plans. If there's any cyber gaps in your practice, they'll probably be high up on the list. And that's something we're really wanting to try and support practices, hence why there was that separate cyber grant. So if you were part of that, there'll be a couple of questions that will be asked again in the digital care assessment, but this has a much broader scope in terms of digital health. I think Jasmine had a couple more questions she popped in the chat as well.
I can answer those. So the question is, you're saying that we can expect our individual reports for the Savvy assessment around the 7th of October if we have already completed the assessment. So yeah, that's correct. That's what we're aiming for. And those results will probably include your score and potentially what tier you'll be in. And it might highlight some of those key areas for you. The other question is explaining more about what types of grants might become available in the sustainability and viability space. So to be confirmed. And as I mentioned in the presentation, that'll all be informed by how people answer in the assessment. So what are the key needs, and that'll inform, for example, what grants we roll out. So, for example, if there's a lot of issues around, business development, we could offer a grant around that. So we want to first find out where those key themes are, but in order to do that, we need more voices, right? So we'd like to hear from as many people as we can, so we can really make that accurate decision about what initiatives are needed. Yeah, great question. Thank you.
I'll just add to that, Peter. Just if you haven't seen already, our Allied Health Conference it will be run next year on the 15th and 16th of May 2026. Day 2 of that will be a severe taster, I suppose, session, workshop. And the theme of that will be boosting financial performance and team empowerment. So it's really about team culture as well. So that's sort of hot off the press information. That's sort of going to go out in the registration links next week. So that, and to be able to participate in that workshop, you would have to complete the severe assessment. So that gives you a bit of a taster of what some of the things might look like in a group session as well. So any other questions?
I can add a little bit to the rollout of initiatives as well. I also work on the Savvy for GP side of things as well. What we're sort of aiming to do is have some of these initiatives scaled up to both GP and allied health as well. So it gives the opportunity for all these healthcare practitioners to be in the same room where it makes sense, where it makes sense, where the information is the same, whether you work in a GP practice or an allied health practices. As we know, more and more practices are becoming a little bit more integrated. So as much as we can, we'd like to be able to scale that up to all healthcare providers.
On the screen is also the Allied Health at the phn.com.au contact address. So if there are no other questions coming through, but you contemplate one over the next week or two or more, please do reach out to us at any time. Ibby, as we know, is leading the digital care assessment, Peter for the Savvy, but Jodine and myself, who many of you may know, are also available to speak to or by email via that Allied Health email address. Just checking. Joe has put in the Allied Health Conference link, which is also just opened. And we do have a QR code just for today, and that's also another opportunity where you can directly ask us any questions. I'll just wait one more minute, and then we might find out if there's no other immediate questions. We look forward to working with you all.